So Mike, there's one thing that I would like to talk about, that's nerve entrapment syndromes. Now, most people know about carpal tunnel syndrome and some of the effects, or what they believe are some of the effects, but it's a lot more complicated than that. There's a lot of issues going on with all sorts of nerve entrapments throughout the body. Can you tell me a little about that?
Well, there's a few nerve entrapments that most people know about. Carpal tunnel is probably the big buzzword. The interesting thing about carpal tunnel, though, the nerve entrapment is very seldom at the carpal tunnel.
Right.
It's usually farther up the arm. And if you actually can figure that out, you have a much better chance of fixing it. So we spend a lot of time knowing where to work on a nerve,
Right.
rather than just diagnosing everyone with carpal tunnel syndrome.
Right.
Another one is sciatica. A lot of people hear the word sciatica. Pain down the back of the leg, from the back or just in the back of the leg, sometimes all the way to the foot. The real issue, though, is that there are 92 places for the nerve to get entrapped, 92 common ones. So it's really an education process to get a provider to really understand all 92 of those. And that's what we do. If you can put your hand on exactly the place that the nerve is getting a pressure, and then make the nerve move one way and the muscle move another way, or get the nerve to move underneath the tissue where it's trapped, you're probably going to fix it. So in effect, what we see is people that have had sciatica, and they say they have a disc problem or sciatica, and they've had it for 20 years,
Yes.
and in 5 minutes it's gone. It looks like a miracle to them. It probably is a miracle, but where it comes from is really understanding nerve entrapments to a whole nother level. And that's what an ART provider should know.
So in terms of the training for a provider to get to that level, what are some of the things that they should actually, the individual should look for in terms of trying to find someone who has the expertise to do that?
Training in ART is really on two different pathways, two different scales. One is time. There's no way you can get the physical skills in a month. It takes, we do a seminar over a 4-day session.
Yes.
I can get someone to 50% results in the 4 days, which I think is great. They're going to be head and shoulders above anyone else. But I want them to be much higher than that. It takes about 2 years to get 80%. And it's like anything else. The more you do it, the better you get, the better you understand it. And physically, the better you get at it with your hands. This, after all, is an art.
Yes.
ART is an art.
Right, right.
And then the second scale is, there's a lot of information to put in our heads.
Okay.
So there's the basic courses are upper extremity, lower extremity, and spine,
Yes. Yes.
which basically covers the whole body. And then there's nerve entrapments, biomechanics, a master's course, which is really on the fine-tuning of touch, and then a diagnosis course, which is movement screening, as well as differential palpation or active palpation techniques. That's where we teach the provider to be able to tell the difference between that muscle and that muscle. Make one move one way and the other move the other way, and then I can feel exactly which is which. Not only that, but I can feel exactly what is wrong to a whole nother level. So you look at who's taken most of or all of those courses and how long they've been providing. That'll give you a good idea where they are on these pathways of getting good.
Right. Excellent.
The last part, though, is unfortunately in healthcare, most of us, me included, the whole area of soft tissue, we all learned it as this very general area of soft tissue. It's kind of lumped into the massage or soft tissue work. And almost all of us thought that we knew how to do soft tissue. So somebody asked me, can you do that? I said, oh yeah, I can do that, it's soft tissue. That's really simple. Well, we've moved on now. Now it's more like radiology or oncology. It's really a specialist area.
Yes. Yes.
And we've taken it to many more steps beyond that general area. So what I suggest to people is ask your healthcare provider, can you tell me who is certified in current in ART? Do you know anyone who's certified in current ART? Or look on the website. Everyone who's certified in current in ART is on the activerelease.com website. Put in your zip code, you can find out who actually does ART. Instead of saying, oh yeah, I know how to do that.
And it gives us a history on how long this person has been practicing too, so they can actually, besides taking the course, they can actually see as this person developed enough time to actually get the expertise.
Yeah, it does. It'll give you good information to find somebody who can help you.